You're listening to a brief excerpt from the State of Health Plan Subrogation Expert Tips on Maximizing Subrogation Success webinar presentation, co-sponsored by Conduit. This webinar included a lively panel discussion moderated by MCOL's President Clyde Riddle with Deborah Whaley, Senior Executive Subrogation Analyst, Benefits Division with Trustmark Companies, Ryan L. Woody, Partner Mathieson, Wickard & Lair, and Maura Yerke, Director of Subrogation Recovery Operations, Conduit.
So the first key is effective and efficient case identification. It's done by utilizing data analytics, refining algorithms, so you're identifying claims with the highest probability of being related to a subrogatable event. Taking that important first step leads to a much more targeted and efficient investigation into the episodes of care and making sure that you are identifying all possible opportunities.
So, speaking from a litigation perspective, so we're at the end of that process there of that chart. I can tell you what I look for when I'm consulting with clients on potential new cases. First, I'm looking for what I guess I would call as a gapless subrogation file. So I want to know, I'm trying to tell the client, is this going to be a positive subrogation recovery if we take it to litigation? And, in a litigated case, the subrogation file is going to be scrutinized and any missteps are going to be magnified. So I'm looking for any big gaps in the file or potential mistakes. Were the notices late? Did the claims handler change in the middle, and so we missed some communications? Did we fail to timely respond to requests for the lien or a final lien, for documents?
So Deborah, from a payer perspective, what do you think is the most challenging about pulling together these elements for your subrogation program?
Well, the first thing I think is, we're representing our clients, our people that are out in the world running their own businesses, day after day, and subrogation isn't something that's really on their radar. So when we need to reach out to them for something, that gets really challenging where they don't understand. And going back to what I had mentioned earlier about education, really trying to push things out, even in their own company newsletters, information about subrogation, and so that their employees, the members, understand, the obligation contractually they have once they receive payment on a benefit on a claim. There then arises a responsibility for them to repay their employer. So working with that, but the main thing I think is knowing your client. We have such a diversity of clients, and some of them have very rich employer plans. And so they may not want to be approaching things in too much in an aggressive way. So balancing that, then where you have a plan that says, yeah, go get them. So knowing your client, knowing their culture, and bringing the understanding of what the service is, why it is important to them and their bottom line as far as getting those benefit dollars back into their accounts, and how critical what we do it really is for their overall success.
You've been listening to a brief excerpt from the State of Health Plan Subrogation Expert Tips on Maximizing Subrogation Success webinar presentation. This webinar was co-sponsored by Conduit and recorded on September 1st, 2021. You can watch the full webinar video by using the link that appears now on your screen.